Did you know that perinatal mood and anxiety disorders are the #1 complication of pregnancy, affecting up to 1 in 5 moms and 1 in 10 dads? It's not just about the baby blues. In fact, the baby blues is something that occurs in up to 80% of women, and this is something that occurs in the first few weeks after giving birth. It's a result of all of the physical things that are happening, the hormone changes, the sleep deprivation, and the adjustment into new motherhood. It's not a mild form of depression. Some women can experience depression, and that can look like sadness and crying. It can look like feeling overwhelmed. I've heard women say they feel like they have a fog over their head, or they feel like they're in a pit and they can't get out, that they've lost themselves. You can also have some irritability with depression, and in some cases have thoughts of suicide. You can also experience anxiety in the postpartum or in pregnancy, and this is something where women describe feeling like they have like 20 browsers open in their minds, and they can't focus on one thing. They might have racing hearts and fidgeting all of the time and wanting to plan things out. They may experience fear and worry over anything. They might have difficulty sleeping or eating. You can also have postpartum OCD, which involves obsessive thoughts about bad things happening, or even pictures in your mind of really awful things happening that feel overwhelming to you. You might have high anxiety during this time. We always tell moms with postpartum OCD that thoughts don't equal action. You can also experience trauma around pregnancy and postpartum, and that can be a result of previous trauma or trauma as a result of your birth or postpartum period. And there's treatment for that. PTSD looks like hypervigilance, which you're meaning on edge, jumpy. It can be disconnecting from things. It can be high anxiety, difficulty sleeping, irritability, and anger. And in rare cases, you can have postpartum psychosis, which occurs in about 1 to 2 of every 1,000 births. And this is truly a medical emergency. Moms can experience false beliefs about their babies or about the world around them. They can experience hallucinations, seeing things and hearing things that maybe aren't there. And we need to make sure that mom gets help in those cases and is stabilized so that she can be safe and baby can be safe. The most important thing to remember is that with proper care, these issues are treatable. That you are not alone. This is the #1 complication of pregnancy. There is treatment available, and you can be well.